Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Kaposi sarcoma and its classification. So we begin with the classic. So under the classic, it is in older men. It is seen in terms of the older men. So older men of the Eastern European as well as the Mediterranean origin. So they are of the Eastern European. So Eastern European as well as the Mediterranean origin. Next, it is not associated with the HIV. So it is not associated with the HIV, and there is presence of the skin plaques and nodules. There is presence of the skin plaques as well as the presence of the nodules. They are seen. So in Kaposi sarcoma, we saw the classic. Then we move on to the endemic African. So in terms of the endemic African, it is seen in terms of the HIV. So it is a HIV seronegative individuals. So HIV seronegative individuals, and also there is a predominant lymph node and the visceral involvement. So there is predominant lymph node as well as the visceral involvement. There is a visceral involvement seen. Then we move on to the transplant associated. So in terms of the transplant associated, it is nothing but a solid organ transplant. So there is solid organ transplant recipients, and it involves the lymph node, mucosa as well as the viscera. So it involves the lymph node, mucosa as well as the viscera, and there is also the cutaneous lesion. The cutaneous lesions. So the cutaneous lesions, they may be absent. Now let's move on to the AIDS associated epidemic Kaposi sarcoma. So in terms of the AIDS associated epidemic, so let's write epidemic. So epidemic case, that is Kaposi sarcoma. So in this case, there is a HIV infected individuals. So is HIV infected individuals, as well as it involves, what does it involve? It involves a LN, that is a lymph nodes. To learn and grow daily like this, please do subscribe.